eczema or atopic dermatitis. It is a chronic allergic inflammatory disease of the skin which is a lifelong affecting disease. It fades away or disappears, and after several months or several years it may flare up. That is the recurrence of the disease is the characteristic of this dermatological complication. It is produced by the allergens which are dust mite, ticks, pollen, pets dander. In addition to these allergens, there are environmental factors which affect the skin of the person. Due to the unhygienic condition of the skin, there is deposition of this allergen over the skin, and the other bacteria like Staphylococcus aureus, which destroy the skin layers and produces cracks, fissures and pores in the skin barrier mechanism, as the function of the skin in human body is protection against the external pathogens which may be living one, virus, fungus, bacteria, or the inanimate like the allergen, pollen allergens, dust and other chemicals and irritants which affect the structure of the skin. There are two types of eczema: dry eczema, in which the skin is dry, crusty and is very itching one, irritating one, and produces physical and psychological troubles. The color of the skin is brown and it is called as elephant skin. Second type is wet eczema, in which the color of the skin is from purple, violet to red one. There is color changes according to the degree of the disease. The skin is wet and there is oozing of the fluid. The genetic factor is also considered to be one of the causes of this disease. There is genetic mutation. There is a gene particular which produces this DNA changes in the skin cells and which causes this eczema. Moreover, the person suffering from other allergic diseases like asthma, allergic rhinitis, hay fever, they have more chances to develop this skin disorder. Initially, there is appearance of rashes over the body, especially the face, around the eyes, cheek, neck, and also in the antecubital area behind the knee joint, lower limbs, upper limbs, hands, feet, etc. In other words, it starts from the face and expands all over the body. Initially it is in the form of rash, but later on it is converted into thickened red patches, which are very itchy, very troublesome, which produces a great distress to the patient. There is no cure for this disease, but the management of the symptom is present and the patient get relief from the medical treatment. Pathophysiology is like other allergic diseases. When the allergens enter through the damaged skins in the form of parasite, bacteria, virus, and other allergens like dust mite, ticks, or in other route of entry is from the respiratory tract. In the season, especially the spring season, there is abundant production of pollen in the air that enter through respiratory tract. So there is production of antigen antibody reaction. Antigen antibody mechanism is produced by the immune system of the body, because immune system come into action against these allergens which they consider that they are the enemies or that they are lethal to the human body. In most cases these allergens are innocent one, but they are considered by our immune system to be lethal one. So there is inflammatory process which is also produced in the skin, and this eczema is the production of the inflammatory process by the immune system, and the cause is the allergens. So these allergens, they are the responsible for these complications. This allergy is produced by food allergens, cosmetic allergens, industrial chemicals, clothing ones, fabric, or the chemical or synthetic clothing, they produces the dermatitis, or in other words it may cause eczema. So in various items of the makeup which are used for the beauticians, in the babies and also in the older ones, or the especially the female ones, they may produce eczema. Mostly the age of onset of the disease is in babies and young children, but it can occur in the teenager, adults and elders ones. So there is no age limit, but it is mostly occurring in the babies and the younger children. Diagnosis of the eczema. On inspection, it is a clear one. There is rash which later on passes into the patches one, which are very itchy one, and if they are infected one by the bacteria or the fungus one, so they are converted into wounds and they become very painful. Blood examination can detect an allergen and the antibody in the blood. The most recent diagnostic test is skin patch test. By this method of examination or diagnostic procedure, we can detect the types and the variety of the allergen producing this troublesome and horrible disease. It is not a continuous disease, it is treated and patient get soothing ones and relief temporarily by the medications, but when the medication is stopped one, it may recur and flare-ups. So this game is going on throughout the life. So at present there is no complete medical or surgical treatment